Now, when it comes to shoulder pain, shoulder impingement is probably one of the most common conditions I treat as a physical therapist, and patients normally complain of pain over the top side of the shoulder, which limit their ability to reach their arm up and overhead. And if you're someone that's dealing with this now, you probably understand that this is very unpleasant, and you probably can see how it can affect your day-to-day activities. Well, in today's video, I wanted to share with you 5 effective exercises that you can use to help heal shoulder impingement fast. And make sure to stick around to the end of this video because I wanted to teach you the one habit that you need to be incorporating to help ensure that you get rid of this pain for good. Let's get started. Welcome back, guys. It's Dr. Mike, and I'm a physical therapist providing tips on how to build strength and longevity with your body. Today, we're going to be providing you with a step-by-step process on some of the things that you need to be working on in order to get out of pain that is caused by shoulder impingement. Now, if you're someone that is familiar with my channel, you know that I greatly believe in the benefits of myofascial release, massage, soft tissue mobilization, whatever we want to call it, but basically using a tool kind of like a lacrosse ball to help work on and mobilize and move a lot of the structures in the shoulder. For today's first technique, we're gonna allow you to focus on a few different areas. So we're gonna focus on the posterior capsule, which is behind the shoulder. We're gonna focus on the front of the pecs. And then most importantly, we're gonna focus on the lats. So these are the 3 areas that we commonly see get very tight in these individuals that have pain here. And so when you're using something like this, like a tennis ball or a lacrosse ball, we're gonna focus on first starting off with the posterior capsule here. So you're gonna place the ball kind of on the back side of the shoulder there, and you're gonna feel some sensitive spots. And the more you're leaning on the ball, the more pressure you're gonna be applying over the muscle. And essentially you're gonna take that arm in an extended position here. Notice also my thumb is facing up, and now you're gonna move your arm towards the midline. You might have to find an area where you don't essentially roll your body off the ball, but you're kind of pinning the ball close to the wall. And now you're taking your arm through some active motion, basically taking the arm and moving it towards the middle here. That is stretching a lot of the tissue behind the shoulder. And some of you might already actually experience some relief by working on some of the structures behind the shoulder, okay? Next, we're gonna move on to the lats, which is underneath here. And now this is that large muscle that kind of wraps underneath the shoulder there, which is commonly tight in individuals that have this pain. So you're gonna pin it against the wall just like so. And now, still keeping that thumb facing upward, we're now taking that arm all the way up overhead. And sometimes I can use my opposite hand to stabilize the ball so it's not sliding all over the place. But now I'm gonna work through some active range of motion. And if you're really flared up or you have a lot of pain, you might just work on just a smaller range of motion. And then as you get better, you're gonna focus on being able to go a little bit higher with that. In each position, you can hang out for about a minute there. And then the last piece, which I'm gonna show you on the left shoulder for the purpose of the camera view, is now we're gonna place the ball on the front side here, specifically the pecs, which is gonna be very tender. And so you're essentially gonna lean towards the wall just like so. And now you're gonna take your hand and place it behind you. So you're kind of stretching and winding up those tissues as you apply pressure along the pec area, and you can really just focus on moving your body left to right, and you can go up and down, and really you're just locating the sensitive areas that you can really get some good release in and to help start being able to move that shoulder better. So now that we've taught you how to address the soft tissue around the shoulder, now we're gonna teach you a stretch that's going to help stretch the back of the shoulder here. Specifically, this is the posterior capsule, and this is an area that we commonly see get very stiff on a lot of people here. So if I'm focusing on my right shoulder here, I'm gonna simply place my hand over the top of the opposite shoulder, and then I'm gonna take that left arm and I'm gonna place it over the elbow. Now, using my left arm, I'm going to be working on, once again, pulling the elbow towards the midline. Anytime I take that shoulder in this, what we call horizontal adduction, it is stretching all of the tissue and the joint capsule behind the shoulder, which can be greatly effective. So you can simply work on pulling that elbow towards the midline. This doesn't seem like much, but you're gonna feel a lot of stretch on the back of the shoulder there. And you're gonna simply hold that for at least 60 seconds at a time. You can work on anywhere between 2 to 3 reps, and then we're gonna move on to the next exercise. So the next exercise we're gonna focus on is really gonna help address a lot of the stiffness and tightness on the front of the chest. And we're gonna call this a snow angel. And if you notice here, I'm on a foam roller and that is down the mid spine there. So I'm kind of forced to be in this extension position rather than being flexed here. And all I'm gonna do is, with my palms facing upward, I'm going to focus on just allowing my arms to fall down at the side. And really, I should feel a lot of the pulling of the chest there. You can work through about 8 to 12 reps where we're really trying to keep the lower back in contact with the foam roller, and we're not arching our spine. We're trying to keep it nice and close, and we're really focusing on reaching those shoulders and feeling all of the tissue on the rib cage and even around the shoulders really start to open up and start to move those shoulder joints to greater range of motion. This also tends to be a little easier for people, especially because you are simply laying down, which allows gravity to assist your arms while you're moving them versus if you were just standing up, moving your arms against gravity. So this tends to be a little easier for people. Obviously, if you can't go as far up over your shoulder, then you may kind of stop there where you feel that pain or that stiffness, and then you're gonna come all the way back down, ensuring that you keep those palms facing up towards the ceiling there. Now, one of the areas that often gets forgotten about, especially when dealing with any type of shoulder pain, is how much of the influence the upper back or the thoracic spine can have on the shoulder. So if we're stiff and we have a stiff upper spine or upper back, that's going to greatly influence your ability to move your shoulder through greater range of motion. So the next exercise we're going to teach you is going to help improve thoracic extension and some rotation, because most of us are flexed over and bent, whether we're on phones or computers during the day, or even just driving, we're kind of hunched over. So this is going to help with your posture and improving the upper back stiffness there. So you're going to start on hands and knees, and I'm going to focus on my right shoulder. So we're assuming this is my painful shoulder, but you can actually benefit from performing this on both sides. And we could do about 5 reps on each side. And it's important that you try to breathe through this exercise. So what you're going to do is you're going to take one hand and you're going to reach it underneath. We're going to call this thread the needle. And you're reaching your arm all the way underneath as far as you can go. You're going to start to get some rotation through the spine. Reach as far as you can go. And then once you can't go any further, now you're going to take that arm and reverse in the opposite direction. And now we're placing that elbow up and our hand behind our head. And now with that elbow, I'm going to reach up and try to point my elbow up towards the ceiling. Okay? You're noticing now why this is called thread the needle, because this is essentially taking your spine through this nice rotation and really forcing you to get in a position that normally we're not used to getting in, especially this area here. Point that elbow up, really focus on trying to allow your body to move through greater range of motion as you're moving. We'll work on 5 reps on each side. And that will be it. Now we can focus on all the mobility work in the world, but if we're not focusing on strengthening as well, we're truly not solving the problem for the long run. Next, we're gonna teach you a standing W exercise, which is gonna help focus on strengthening the posterior rotator cuff and all of the scapular muscles on the back of the upper back, which is going to allow you to really have improved posture and improved positioning of that shoulder there, okay? So you're simply gonna grab a resistance band. I just have a TheraBand here, and you're gonna wrap it around something that's very sturdy here. And now I'm gonna position my thumbs to where they're facing backwards. So at the shoulder, we're talking about this external rotation. not with our palm facing down, but actually our palm facing up. I'm gonna grab a hold of the band here and keeping my elbows close to my body. Now I'm gonna focus on really pulling those wrists and my shoulder blades back, squeezing the upper back muscles just like so. And then you're gonna relax by allowing your wrist to move away from you. And then once again, notice I'm keeping my elbows close to my side. I'm pulling those wrists back. I'm pulling those shoulder blades back, really thinking about making a W with my body. And then I'm gonna squeeze there, and then I'm gonna relax. So I can work on between 2 to 3 sets of 10 to 12 repetitions to really focus on strengthening the upper back and the back of the shoulder muscles, okay? Now, if you made it this far and you're finding value in this information, please support this channel and the growth by giving this video a thumbs up or leave a comment below on which of these exercises have been your favorite so far. Now, the last tip and the last habit that you must understand to help ensure that this pain is gone for good is by implementing and incorporating some hanging into your routine. Now, this may mean that you may not be able to hang from a bar with just body weight, so you might perform this initially assisted with your feet on the ground. But if you can tolerate hanging, what this is going to do is it's going to stretch all of the tissue of the shoulder, and it's gonna allow you to use your body weight to kind of pull the shoulder joint away from the scapula or the shoulder blade, okay? So essentially you're creating a gapping mechanism, which is essentially good for pain relieving and helping to really just open up the shoulder area. And so what I'll do is I'll basically have patients start by kind of facing their hands away from them. So they're in this, what we call overhand grip. And right now my feet are supported on the ground, but as I get better with this, I can slowly allow my body to kind of just hang. And you might start off with slowly, maybe building up with 5 seconds at a time, 10 seconds at a time, and eventually being able to hold your body weight for 20 to 30 seconds at a time. When you hang from this bar, not only are you feeling the stretch out of your shoulder, but you're also gonna feel the stretch of the mid-back and your spine kind of decompressing. So you're gonna have major benefits to this exercise, and over time, you're gonna get better with it, with being able to hold for longer periods at a time. And you'll also notice that naturally your range of motion and your flexibility in your upper back and in your shoulder is actually going to improve and start to help you get out of pain faster. Now, if these exercises were helpful for you and you truly believe in shoulder health, then you know that working on your mobility and your strength is a long-term game. And if you want more information on how you can improve your mobility and your strength in your shoulders, take a look at the videos I made up here. In the meantime, please support me by subscribing to the channel, give this video a thumbs up, and please hit that notification button to stay up to date with all upcoming videos. I'll see you in the next one.